Hi, my name is Kevin, and today I will be presenting an overview of the 2020 cyber incident at Enlo Health, the hospital system where I work. I'll cover the event, the scope, the response, the lessons learned, and how I would manage it from a CISO perspective. Sure. During 2020, during the height of the COVID-19 pandemic, Enlo experienced a cyber attack that impacted portions of the IT environment. Out of caution, Enlo temporarily limited system access to protect patient care systems while security teams responded. Clinical care continued work using downtime workflows, and the staff adapted quickly to ensure continuity. Enlo sent notification letters directly to affected patients, explaining that some basic patient information stored in certain systems may have been accessible. These included names, contact details, limited visit or department of care context. The latter stated that there was no evidence of social security numbers, financial information, or full medical records being accessed or misused. Because the information involved related to patient healthcare encounters, the incident notifications were handled under the HIPAA breach notification rule, which requires healthcare organizations to notify affected individuals if certain protective health information may have been accessed. So the exact technical entry point was not made public, which is pretty standard for hospital security to prevent uh, ongoing defense posture. However, the attack aligned with the widespread ransomware campaigns that targeted healthcare organizations during COVID-19. The incident demonstrated a need for stronger continuous monitoring and threat detection. So after the incident, Enlo took major steps to raise cybersecurity maturity. They implemented a 24/7 real-time security operations center monitoring via Palo Alto networks. They brought in a virtual chief information security officer through Clearwater to guide long-term security strategy, and they strengthened security awareness training, leadership visibility, and incident readiness across departments. The likely motivation was financial, which was consistent with healthcare targeted ransomwares during the pandemic. Hospitals are a high pressure, high value environment, making them very common targets, especially in 2020. So some key takeaways include cybersecurity must be a cultural thing, not just a technical thing. Every employee plays a big role in preventing phishing and suspicious access. Zero trust segmentation reduces impact if an attacker gains entry, and tabletop and downtime drills are really important, and they need to be practiced regularly so that real world response is very smooth. If I were the CISO, during the first 72 hours, I would try to contain and isolate all the affected systems. I would preserve forensic evidence, and I would coordinate communication with clinician leadership to minimize care disruption. In the next 30 to 90 days, I would expand SOC alert visibility. I'd validate access permissions, provide backup and disaster recovery procedures, and really focus on staff retraining. And then long term, I just keep this staff improvement, just trying to keep those systems as protected as possible and really trying to strengthen those vendor and security system reviews. Thank you very much.